All right. Hi, everyone. So today we're going to be discussing chapter 40, heat and cold applications. So using heat and cold. So the use of heat and cold for ailments has been practiced for centuries. So let's say if you have any, let's say sprains or any ailments. So people are saying, oh, you're gonna do hot compress or cold compress. So this has been practiced for centuries. So today, traditional healers, physicians, nurses, and physiotherapists using or uses heat and cold application to reduce tissue swelling. So there has been a trend towards the use of heat as part of healing. So blending both ancient indigenous practices and modern practices. Okay, so let's go to your book and uh, let's read this one over here. Indigenous healing sweats. Aboriginal traditional healing is a broad term that describes the many different healing traditions within the different belief systems in Canada's Indigenous cultures. This healing has been used by Indigenous people for thousands of years. Healing within these traditions is seen as a journey, and there is as much focus on spiritual and emotional healing as there is on the physical aspect of healing. Health is seen as balance and harmony within the mind, body, and spirit, along with our communities and environments. Illnesses or diseases is caused by ignoring sacred natural laws. Sweats are used as one type of healing, and this ritual is both a cleansing and healing one. It is most often done in a sweat lodge, which is run by a person, often an elder, who has been trained to conduct the sacred ceremony. Sacred herbs may be added to the smoke and steam during the ceremony. Okay, so that is the indigenous healing sweat. So let's go back to our slide. So heat and cold application. So heat and cold application promote healing and comfort, as well as it reduces tissue swelling. Okay, heat and cold have opposite effects on the body function. So they have opposite effect. Okay, so we're gonna learn more of that later. So you must understand the purposes, effects, and complications of heat and cold application. So let's go to the general guidelines. General guidelines of heat and cold. Let me see what page 41. Okay, so 401 over here. So comparison between heat and cold application. So what is the purpose of heat? So for persistent chronic pain. So when you say persistent ongoing, right? So heat is good to reduce pain for muscle cramps, reduces pain related to arthritis, promotes healing, as well reduces joint stiffness. So heat application is recommended. So for the cold, okay, application, it is intended for recent injury. It because it reduces swelling, reduces pain, it slows bruising, reduces itching from insect bite. So recent injury. But for the heat, is gonna be a chronic pain. Okay. So how it works? So heat application, it expands blood vessels and assists in increasing circulation to the area. And on the other hand, the cold compress. So as I have mentioned in the first few slides, that is the opposite. So if the blood vessels expands or dilates in the heat, the cold is the opposite. It constricts blood vessels to reduce swelling and pain in the area. So examples of heat, all right. So we have the moist, hot, warm compress, hot, warm soak, as well the sits bath. So that is moist. Okay. So pretty much when you say moist, there is a water added to it. For the cold moist, cold cool water compressed, and then cold cool water soak. And there's another one for the heat. We have the dry heat. So we call it, so water is not, part of the compress. So heating bags or bean bags, heating pads or heat rugs. For the dry, water is not visible. So we have cold pack, gel pack, ice pack, bags and collars or cold rubs. So length of time for application. So for the heat, do not apply longer than 15 minutes at a time. Check the client's skin every 5 minutes. Okay, so same with the cold. Do not apply longer than 15 minutes at a time. Check the client's skin every 5 minutes. Cold applications are usually applied in 15-minute interval. So for example, 15-minute on followed by 15-minute off. Okay. All right. So signs of problems. Stop application and report as once. If you see, you observe, you stop, and then you report. Okay. For the heat, excessive skin redness in the area, maybe it signals it's already, the skin is burnt. Excessive facial redness, there's a blister, complaints of discomfort, pain, or burning, or changes in the client's behavior. Signs of skin irritation such as redness, rash, itching, or burning. And for the cold, there, if you can observe a pale, white, or gray skin, cyanosis or bluish skin color, shivering, complaints of discomfort, pain, numbness, or burning, or change in the client's behavior. Signs of skin irritation such as redness, rash, itching, or burning. Complication from misuse. Okay, so if you misuse the heat application, so it can result into burns, tissue death, as well as circulatory shock. And for the cold, frostbite can occur, tissue death can develop, and then circulatory shock. All right, so let's continue. So doctors and nurses and physiotherapists use heat and cold applications. So before you apply heat or cold applications, make sure that your provincial or territorial laws and employers policies allow you to perform the procedure. Okay, because even if we have this cold hidden cold application policy, but we in my unit we have to follow it. This is not just at home that, oh, just warm up the bin bag and you're good to go. No, you have to follow the policy. This procedure is in if this is procedure is in your job description and in the care plan that the client needs either heat or cold application. And of course, you have the necessary training. Okay. You know how to use the equipment and have reviewed the procedure with the nurse delegated, right? A nurse is available to answer questions and to supervise you. Okay, so let's move on. So support workers are never to use heat or cold applications unless they are in the client's care plan. And then only if this duty has been delegated by a nurse. So let's say for example, you are in a client's home, right? So in a client's home, the client asks you, "Oh, Stella, can you heat this one, please, in the microwave?" If that is not in the care plan, I have to call the supervisor. I have to call the supervisor because if you even you're gonna say, "Miss, I just warm it up. I didn't apply it. The client applied, but the client got burned because you did put it in the microwave, right? So again, accessory to the crime. So you have to call the supervisor for guidance. Okay, so just tell the client, "Oh, Mr. Jones is not part of my a scope of practice or a part of my job description that I'm gonna heat up a heating pad or a bean bag in the microwave. So let's say a family member did it. So just inform still your supervisor that, or in your progress notes that noted to be noted that client is using a bean bag heated by a family member. Okay, so just to make sure that the team, the healthcare team is aware. All right, so any client receiving a heat or cold application should be checked frequently for any signs of problems related to their use. Okay? All right, so let me double check over here. This is the general guidelines. So hold on, let me double check the general guidelines. So we did already the comparison, but we're gonna check the guidelines. There you go. I found it. There. So general guidelines for applying heat or cold. So apply only one, okay, ordered by professionals, two, allowed by your employer, three, you are assigned to do so. Know how to use the equipment. So before applying moist applications, measure the temperature according to your employer's policy. Follow employer's policies for safe temperature ranges. Okay? Do not apply hot application above 41.1 degrees centigrade or 106 degrees Fahrenheit because tissue damage can occur. Only a nurse can apply a very hot application. So ask your supervisor what the temperature of the application should be for each client. Okay, so we're gonna read that one later about safety. So cooler temperatures are used for clients at risk. Cold, warmer temperatures are used for clients at risk. So, know the precise site of the application. Ask your supervisor to show you the site. Before applying a dry heat or cold application, cover it with flannel or terry cloth cover, towel, or pillowcase according to your employer's policy. Do not leave clients at risk unattended. Observe the client's skin at least every 5 minutes for signs of complications. Observe for changes in the client's behavior, which may indicate pain. Remind the client not to change the temperature of the application. Prevent chills. When moist heat is applied, the increased blood flow to the affected area may cause reduced blood flow to other body parts, and the client may feel chilled. Cover the client with a blanket or robe. Eliminate room drafts. Offering the client socks to wear will help to ensure warmth. Also, ask your supervisor how long to leave the application in place. Carefully watch the time. Heat and cold are applied for no longer than 15-minute periods. Provide for privacy. Properly draped and screen the client. Expose only the body part on which you will apply heat, or cold. It is safe to leave, place the call bell within the client's reach, or remain within easy hearing distance. Follow standard practices. Wear gloves if you or the client has non-intact skin. Okay. So over here, let's go heat and cold temperature ranges. So temperature very hot, it ranges 41.1 to 46.1 degrees centigrade or 106 to 115 degrees Fahrenheit. The hot is between 36.6 to 41.1 degrees centigrade or 98 to 106 degrees Fahrenheit. Warm, 33.8 degrees centigrade to 36.6 centigrade or 93 to 98 degrees Fahrenheit. Tepid, 26.6 degrees to 33.8 degrees Celsius or 80 to 93 degrees Fahrenheit. Cool, 18.3 to 26.6 degrees Fahrenheit or degrees Celsius or 65 to 80 degrees Fahrenheit. And then for the cold, 10 to 18.3 degrees Celsius or 50 to 65 degrees Fahrenheit. Okay, so just be mindful of that one. But again, you will gonna be, just in case it's part of your in the care plan, part of your job description. So definitely you're gonna be trained by the nurse. Okay, so let's continue. So heat application can be applied to most any body part. So are often used for musculoskeletal injuries or conditions. Heat does the following. It relieves pain, it relaxes muscles, it promotes healing, reduces tissue swelling, as well as what? Decreases joint stiffness. Okay? So when heat is applied to the skin, so what is the reaction? What's going on? So blood vessels in the area dilate. So when you say dilate, it opens up. Okay, blood flow increases. Tissue have more oxygen and nutrients for healing. Excessive fluid is removed from the area faster, and the skin is red and warm. Okay, so that's for the heat application when the blood vessels is dilated. So, what are the complications? So, high temperatures can cause burns. When heat is applied too long or it's too high, it can result in pain, excessive redness, and blisters. So, if not treated right away, burns can lead to serious life threatening problems. Okay? So, let's go back to over here. Let's think about safety. All right. So think about safety for heat and cold application. So both heat and cold application can be either moist or dry. So as a support worker, you must thoroughly understand the purposes, effects, and complications of both heat and cold applications. Because of the risk involved, some employers allow only nurses to do heat and cold applications while some others may permit support workers to do them as well. As always, you must be certain that the procedure is within your scope of practice and follows your employer's policies. Before you perform these procedures, it is your responsibility to make sure of the following: your provincial or territorial laws and employer's policies allow you to perform the procedure. The procedure is in your job description. You have the necessary training. You are familiar with the equipment. You have reviewed the procedure with the nurse, and the nurse is available to answer questions and to supervise you. Okay? All right. So over here, where is it? No. Oh, there's another one over here. Let's finish up here first. Okay. So, complication again. So, clients at risk for heat complication includes clients with thin, fragile, or delicate skin, clients with decreased sensation, clients with dementia or confusion. They don't know what's going on. They get confused, right? And apraxia. I know it's not apraxia. Anosognosia. Cannot actually it's a fracture, I believe. It's or agnosia, the loss of ability to recognize. Okay, they cannot recognize what is that for, and then they get burned, and then of course the decrease of sensation on nerve endings. So it takes them forever for them to feel because of the nerve endings are decreased. Okay, clients with mental implants. Oh yeah, because if you put the one in the metal will gonna heat up, right? Okay, so types of heat application. So moist heat application. So water is in contact with the skin. So moist. Moist heat has greater and faster effects than dry heat. So heat penetrates deeper with moist application. So to prevent injury, moist heat applications have lower temperatures than dry heat applications. So types of applications. A warm compress is a moistened pad applied over a body area. So we have the warm compress. And another one is a warm soak, which involves putting a body part into water. And we have a sitz bath, involves immersing the perineal and the rectal areas in in the warm water. And also we have a warm or cold packs. A pack involves wrapping a body part with a wet or dry application. Okay, so let's go over here. So that is moist, right? So let's go to dry application. Okay. So examples of dry application, heating or microwavable bean bags. Water is not in contact with the skin. That's why it's dry. The application stays at desired temperature longer. Dry heat does not penetrate as deeply as moist heat. So dry heat needs higher temperatures to achieve the desired effect. But burns are at risk. Okay? Check the skin under application every 5 minutes and never leave on longer than 15 minutes. Okay? So let's go to cold application. So cold application are used to what? To treat sprains and fractures. That is the recent injury, right? For the heat is persistent or ongoing or chronic. So treat sprains and fractures, reduce pain, prevent swelling, and decrease circulation and bleeding. Cool the body when fever is present. So we do apply cold application. Cold has the opposite effect of heat. So when you put heat, it dilates. So when you put cold, when cold is applied to the skin, vessels constrict. So cold applications are useful right after injury. Okay, so let me see if we can find box procedure. Oh, hold on, not that one. Over. Okay, so let's think about the cold application. The warm soak. Mm. All right, so we'll read this one later. So hold on. Applying cold compress. Okay, so let's go back first over here. This is a very short. Oopsie. Let's go back here first. Okay, and then later, we're gonna read the procedure. Okay, so what are the complications of cold application? So it can lead to what? To frostbite. So what is frostbite? So frostbite is a medical condition in which damage is caused to the skin and other tissues due to what? Extreme cold. Do not use cold applications on old injuries. Also, pain, burns, and blister can happen from intense cold. So when dry cold is in direct contact with the skin, okay, so it can cause pain, burns, or blister. Cyanosis, it can happen when cold is applied for a long period of time. Blood vessels dilate instead of constriction; they dilate. So you have to check a client every 5 minutes or more frequently. So we have the moist and dry application. So it's the same with heat. Okay, moist and dry application penetrate deeper than dry ones, are not as cold as dry applications. Okay, so moist cold application used as a cold compress. Dry cold application include ice bags, ice collars, and ice gloves. Cold packs can be moist or dry application. To protect the person from injury, we have to remember the RICE for recent injury. So RICE. So rest, apply, compress, and elevate. So R is to rest the limb. I is to apply ice to reduce swelling. C is for compression, and then E is to elevate the limb. Okay, so that's how we remember for recent injury, rise. And then uh, for the fire, we have the race, rescue, activate. What is the C? Contain, and E is to evacuate or extinguish. Okay, so for recent injury, we have rise, and for the fire, we have race. Okay, so let me see over here. Guidelines, we did that one. Temperature, we did that. So let's think safety. Okay, clients at high risk for complications from heat and or cold application. So clients with thin, delicate, or fragile skin. So the client include infants, young children, and older persons, and fair-skinned people. Clients who have decreased sensation. Okay, so client who have difficulty sensing heat or pain may not realize if the application is too hot or too cold and are at risk for skin damage. Examples of situations that may reduce a person's ability to feel pain include the following: the loss of consciousness, scarring of the skin, use of some medications, spinal cord injuries, stroke, diabetes, aging, which can cause decreased sensation due to changes in the body function. We already mentioned that one, right? Like the body system. The As we age, also our body system ages. Clients with dementia or confusion. So these clients may not recognize pain, or they may not be able to communicate when they are in pain. You may need to look for changes in the client's behavior, which can signal discomfort. Clients with metal implants, as we have discussed on the slide, so it conducts heat and cold, so deep tissue can be burnt. Okay, pacemaker and joint replacement are made of metal, so do not apply heat in the area of implant. Okay, so let's read also over here home care, heating or bean bags. So the use of heating bags or bean bags has become very popular because they are easy to use and inexpensive. They are often sold under the trade name of magic bag. They can even be made at home. So these bags are warmed in the microwave, but the length of warming time depends on size, components, and the heating power of the client's microwave. So if the client's care plan instructs you to apply them, you should always do the following: heat the bag in the microwave only for the length of time specified in the client's care plan. Never leave the heating bag unattended while it is heating in the microwave. The contents can spark or even catch on fire, similar to microwave popcorn. Always remove the bag immediately if you begin to smell something burning. After heating, shake the bag in order to mix the beans inside, as they usually heat unevenly. Okay, so you have to mix. And never place these bags directly on skin. They should always be wrapped in a pad or towel to avoid injuring the client. Check with your supervisor if you are unsure of the type of cover you should use. For heating pads, electric blankets, and hot water bottles, some home care clients may have electric heating pads or hot water bottles that apply dry heat. These items create serious fire and burn risk. So, support workers are usually not permitted to apply electric heating pads or hot water bottles. So, if a client asks you to apply an electric heating pad or hot water, explain that your employer's policy does not allow you to do this. Find another way to provide warmth to the client, such as giving a blanket or a sweater, and tell your supervisor about the client's request. So, if the clients insist on using the heating pad or hot water bottle while you are on duty, the client may need to sign a legal waiver, sometimes called negotiated risk agreement, with your supervisor before you can apply it. Okay, there you go. Everything is stated in there. So don't be scared, please. All right. So let's go through here. Um, let's read this. Applying warm compress. Okay. So again, of course, we have to promote dips, dignity, independence, individualized care, preferences, privacy, as well as safety. So pre-procedure, of course, you're gonna identify the client according to your employer's policy. You're gonna explain the procedure to the client, practice proper hygiene, and of course, you're going to collect your supplies that needed for warm compress. For example, you need basin, bath thermometer, small towel, washcloth, or a gauze squares, your ties, tape, and rolled gauze, bath towel, large towel, or clean sheet, and waterproof pad. Of course, you're going to provide privacy. Okay? So the procedure, you're gonna place the waterproof pad under the body part to be treated. Okay. And fill the basin one half to two-thirds full with hot water as directed by your supervisor. Measure the water temperature. Place the compress in the water. Wring out the compress. Apply the compress to the area. Note the time. Ask the client if the compress feels comfortable. So if the client is comfortable, cover the compress quickly with a saran wrap. Cover the plastic wrap with a bath towel. Secure the towel in place with ties, tape, or rolled gauze. And then next, place the call bell within the reach of your client. Follow the care plan for bed rail use. Check the area every 5 minutes. So the compress should never be applied longer than 15 minutes. Also, we're going to check for redness and complaints of pain, discomfort, or numbness. Remove the compress if any of these signs occur and tell your supervisor immediately. All right, so change the compress if it cools down. And then you're going to remove the compress after 15 minutes or sooner as directed by your supervisor. Pat the area dry with the towel. Okay, and of course, for the post procedure, we're going to provide the client safety and comfort, remove privacy measures, clean the equipment, discard disposable items, wear gloves for this step when discarding. Follow employer's policy for handling soiled linen, and of course, we're going to practice what? Proper hygiene. And then, of course, you can report and record your actions and observations according to your employer's policy. Okay? All right. So this is the warm soak. Okay? And this is the sit bath. Okay, this one also. All right. So let's go to warm soak. So one warm soak is this one, submerging your body part into the warm water. Okay? So warm soak, of course, the procedure we have to follow from 1 to 5. Okay. So position the client during the procedure. Position the client for treatment. Place the call bell within reach. Place the waterproof pad under the area to be treated. Fill the water basin half full with warm water as directed by your supervisor. Measure the water temperature. So if water temperature is not available, test the water by dipping your inner wrist in the water. If the water feels too warm, add some cold water and mix it in well. Place the client's body part into the water. Pad the edge of the basin with a towel. Note the time. Cover the client with a bath blanket, large towel, or clean sheet for extra warmth. Okay? So check the area every 5 minutes. Check for redness and complaints of pain, discomfort, or numbness. Discontinue the soak if any of the signs are noticed. Wrap the body part in the towel and inform your supervisor at once. Check water temperature every 5 minutes. Change the water as necessary. Wrap the body part in the towel while changing the water. Okay, so remove the body part from the water after 15 minutes and you're gonna pat it dry. Okay, follow step 16 to 20 in the procedure applying warm compresses. All right, and of course, you're gonna report and record if there are any observations, your actions and your observations according to your employer's policy. Okay. So hot and cold compress. This one is a warm pack secured Velcro. Okay. So and this one over here, aquathermia pad. So this is what they say you have to know to do the equipment, right? So of course you have to have a training for this. All right, so let's go through here. We remember the rise, right? So rise for recent injuries. If someone you know or are caring for has suffered recent injury, you should remember the acronym that you probably learned in your first aid class. Rise. R is for rest the limb. Do not try to use it. I is for ice. Apply ice pack to reduce swelling and decrease pain. C is for compression. Wrap a compression bandage designed to provide pressure to a particular area, also known as the tensor bandage, around the affected part, ensuring that it's not too tight. Signs that is too tight include tingling and numbness, followed by increased pain and poor circulation or loss of color, cyanosis of the skin in the extremities and affected body part. And E is to elevate the limb to reduce possible swelling. Remember that the client should be assessed by a healthcare provider as soon as possible to determine if a fracture has occurred. Okay? All right. So over here we have, all right. So let's read this one over here. Uh, Focus on home care, the ice pack. Okay. So disposable ice packs are commonly used in home settings. They are kept in the freezer until needed. Also, a bag of frozen vegetables can be used as a makeshift ice pack. However, make sure the vegetables are not eaten later. So, alternatively, plastic bags can be filled with ice chips, closed securely to prevent leaks, wrap in a clean towel, dishcloth, or pillowcase, and use as ice packs. So remember to apply an ice pack only, okay, if your supervisor assigns the task to you. So if you are familiar with your responsibilities and if it is within your scope of practice, um, within your scope of practice in your province or territories. Okay, so that is the home care. So let's go to applying ice collar, or dry cold pack. So of course we're gonna follow the pre-procedure. Okay, identify the client according to the employer's policy, explain the procedure to the client, practice proper hygiene, as well as we're gonna collect our supplies. So ice bag, collar or glove, crushed ice, cover dishcloth, towel or pillowcase, or paper towels. So apply ice bag, collar or glove, it fill in with water and place the stopper. Turn the device upside down and check for leaks. B. Apply the device. C. Fill the device one half to two-thirds full with crushed ice or ice chips over here. Okay. Remove excess air by bending, twisting, or squeezing the device, or pressing it against a firm surface. So, excess air in the ice bag will reduce its effectivity by creating an air barrier between the ice and the client's skin. So, make sure that the air is out. Okay? And the procedure, apply the device to the appropriate body part as stated in the client's care plan. Secure it in place with ties, tape, and rolled gauze. Note the time. Place the call bell within reach. Follow the care plan for bed rail use. We're going to check every 5 minutes. Check for signs of frostbite, including blisters, pale, white, or gray skin, cyanosis, shivering, numbness, pain, and burning. Remove the device if any of these signs occur and tell your supervisor at once. Remove the device after 15 minutes or as directed by your supervisor. You're going to provide the client safety and comfort. Also, remove privacy measures. Okay? Clean the equipment and the reusable cold pack if used according to the employer's policy and manufacturer's instructions. Discard disposable items, including the disposable ice pack if used. Wear gloves for this step and practice proper hand hygiene after removing and discarding the gloves. Return the pack to its proper location. So follow employer's policy for disposing of soiled linen. Practice proper hygiene. Okay, so that is the um for applying ice bag, ice collar, and dry cold pack. Okay, so applying cold compress. Again, we're gonna follow the pre-procedure 1 to 5, including collecting the supplies. So procedure. We're gonna place the small basin with cold water in the large basin with ice. So the ice will keep the water in the small basin cold, but will keep the ice separate, making it easier to wring out the compresses. And then you're gonna place the compress into the cold water. Place the waterproof pad under the body part. So this keeps the furniture or bedding under the body part dry. Wring out compress. So the compress should be wet but not dripping. Apply the compress to the part. Note the time. So it is important to time all heat and cold treatments to avoid thermal injuries to the client. Place the bell within reach. Follow the care plan for bed rail use. This provides an easy, safe way for the client to contact the staff if necessary. Check the area every 5 minutes. Check for signs of frostbites, blisters, pale, white or gray skin, cyanosis, shivering, numbness, pain, and burning. Remove the compress if any signs occur. Tell your supervisors at once. So this reduces the risk for client injury. Change the compress when it warms up. Usually, compresses need to be changed every 5 minutes. Cold compresses lose effectiveness when they warm up. So remove the compress every 15 minutes or sooner as directed by your supervisor. It is important to time all heat and cold treatment to avoid thermal injuries in the client. Pat the area dry. So drying the skin with the patting motion is gentler than rubbing it with a towel. Okay, patting motion rather than rubbing it with a towel. And then post procedure, we're gonna follow steps 12 to 16 in applying an ice bag, ice collar, or dry cold pack. So afterwards, you're gonna report and record your actions and observations according to the employer's policy. Okay, so let me see over here. So that's all. This is a very short uh, mm, chapter. Okay, so let's go to our review. So, number one, which of the following is true about heat application? A, it will decrease the blood flow. B, hold on. B, it will cause an increase in muscle spasm. C, it will treat recent sprains. Or D, it will reduce joint stiffness. So the correct answer is letter D. So heat application, it can reduce joint stiffness. Okay. Next, number two, which of the following is the greatest threat from heat application? A, infection, B, burns, C, chilling, or D, pressure injuries. So the correct answer is the greatest threat from heat application is letter B, burns. Okay? Number three, who has the greatest risk for a complication from heat application? A 10-year-old boy, B, a teenager, C, a 40-year-old woman, or D, an older person with diabetes. So the correct answer is letter D, an older person with diabetes. Okay? All right. Because of what? Because of the sensation, circulation, or circulation. Number four, when checking the skin under the heat application, which of the following should you report? So when you check the skin under a heat application, which of the following should you report? A, rush. C, warm skin. B, warm skin. C, relaxed muscles. Or D, client sleeping. The correct answer if there's some rush. Okay, of course, there's a warm skin because this is a heat application. Okay, it's warm. Okay, not hot, it's warm. Next, the temperature of the hot application is usually between 26 to 26.6 degrees Celsius to 33.8, B 38.8 to 36.6 Celsius, 33.8, 36.6 to 41 degrees Celsius, or 41 point 1 and 46.1 degrees Celsius. So the correct answer is that is hot, right? So 36.6 because this one is very hot. The letter D. So letter C is the correct answer. Number six, which of the statements about moist heat application is true? Water is never in moist heat, okay? Moist heat. Water is never in contact with the skin. B, moist heat has a greater and faster effect than dry heat. C, dry heat penetrates deeper than moist heat. Or D, moist heat applications are more dangerous than most cold application. The correct answer is letter B. Moist heat has a greater and faster effect than dry heat. Okay, number seven. A client has a warm compress. Which of the following is true? The warm compress is a dry heat application. B. The compress is applied no longer than 5 minutes. C. The area is checked every 5 minutes. D. The compress should never be covered. So the correct answer is letter C. The area is checked every 5 minutes. All right. Number eight. Which of these statements about seats baths is true? A. The foot and leg areas are immersed in warm or hot water for 15 to 20 minutes. B. Weakness and fainting can occur. C. Sitz baths should never be used on men. Or D. The sitz baths last 1 to 2 hours. The correct answer is letter B. So, which of the statements about seat baths is true? Weakness and fainting can occur. Okay? So, number nine, cold applications. A, reduce pain, prevent swelling, and decrease circulation. B, dilate blood vessels. C, prevent the spread of microbes. Or D, are warmed in a microwave oven. So the correct answer is letter A. So cold application reduce pain, prevent swelling, and decrease circulation. All right. So number 10, which of the following is a complication of a cold application? A, fever. B, excess thirst. C, infection. D, frostbite. So the correct answer is letter D. Okay, so complication of cold application is frostbite. So number 11, before applying an ice bag, so A, prepare the bag by running it under hot water. B, measure the temperature of the bag. C, place the bag in a cover. Or D, ask the client to void. So the correct answer is letter C. Place the bag in a cover. Number 12. The moist cold compresses are left in the place no longer than A, 15 minutes, B, 30 minutes, C, 45 minutes, or D, 60 minutes. So moist cold compress are left in place no longer than 15 minutes. Okay? Less than 15 minutes. All right. So,